Well, welcome to the first video of this course on trauma-focused DBT. My name is Dr. Kirby Reutter, and I contract with the Department of Homeland Security to provide mental health services to asylum seekers. I'm also the author of the self-help workbook named the Dialectical Behavioral Therapy Skills Workbook for PTSD, Practical Exercises for Overcoming Trauma and Post-Traumatic Stress Disorder. So once again, welcome to the first video in this course. In this video, we will briefly introduce DBT, including what it stands for and what we mean by dialectical. In this video, we will also introduce trauma-focused DBT, which will be the focus of the rest of this training. So let's get started. So as you probably already know, DBT was originally developed by Dr. Marsha Linehan. She was a psychologist. And the model of DBT was originally designed and developed to treat symptoms of borderline personality disorder. So let's start off with the basics. What is DBT? What does that even stand for? So I think this is an important question because one day I had a client walk into my office and he sat down and he said, "So Kirby, when are we going to do some more of that diabolical brain treatment?" So I don't want to take anything for granted today, including what DBT actually stands for. As it turns out, DBT does not stand for diabolical brain treatment. It stands for dialectical behavior therapy. So I'm going to go on a limb and assume all of you know what therapy means. At least I sure hope so. I'm going to go on another limb and assume you know what behavior means. But what in the world does dialectical mean? Right? That's not a term we tend to use a lot in normal everyday conversation. In fact, dialectical isn't really even a term we have used much in psychology, right? Until DBT came along. What are dialectics? What does it mean to be dialectical? Well, actually, dialectics is a term borrowed from philosophy. And it basically refers to this idea of bringing together opposites, right? So dialectics has to do with looking at things from new or different perspectives. Dialectics also has to do with this idea that two things that seem like opposites can actually both be true at the same time. So obviously throughout this course, we'll be talking a lot more about dialectics, but that's kind of a good enough definition to get us started. An original DBT was based on what Marsha Linehan called the biosocial theory. So the biosocial theory basically says that there are both biological factors which contribute towards the development of borderline personality disorder, but also social or environmental factors, both. So I'm just going to give you some really basic examples of what I mean by biological factors and then also environmental factors. So one example of a biological factor that contributes to borderline is temperament, right? So temperament basically refers to our basic underlying innate personality style, even before nurture or environment has a chance to play a role. And in particular, there are three types of temperaments that seem to contribute towards borderline symptoms. One is a very sensitive temperament. Another is just a high maintenance temperament that's maybe more difficult to deal with. And the third temperament actually isn't even a specific kind of temperament. It's just any temperament that's kind of an outlier. It's just very different from any other temperament within the family. So those are examples of biological factors. But what Marsha Linehan noticed was it wasn't biology alone that leads to borderline. Environment also plays a huge role. And in fact, if you take all of the environmental factors combined, they all boil down to one single theme. And Marsha Linehan identified that theme as invalidation. So this is a very important term concept that we will certainly be talking about a lot more later on in the training. But for now, you can think of invalidation as basically anything that somehow discounts your experience. Right. So what Marsha Linehan noticed was, yes, someone that ends up with borderline does have certain temperaments that seem to predispose them, but they have also been exposed to a lifetime of just constant chronic invalidation. And then what Marsha Linehan noticed was it wasn't even just biological factors or environmental factors that causes borderline. It's really the transaction between the two. In other words, how the two affect each other. So for example, if you have a very sensitive temperament, guess what? You will also be more sensitive to invalidation. Or if you just have a more difficult or high maintenance temperament, guess what? You will probably tend to elicit invalidation in other people, right? Or if you have a temperament that's just completely different than everyone else's in the family, you will be more likely to be feel invalidated or be invalidated, right? So in other words, there's this complex interaction or transaction between biology and environment that ultimately culminates in borderline symptoms. So that's, in a nutshell, Marshall and Hand's biosocial theory. So this training will focus on what I am calling trauma-focused DBT, because the basic underlying theme here is we can't do trauma work while a client is still actively in crisis, right? So the whole point of trauma-focused DBT is to help clients develop skills so that they can sufficiently stabilize or self-regulate so that they can then proceed with deeper trauma work. So I would say that's the main goal of trauma-focused DBT. There's some other goals I want to mention. Another goal is to help clients use their skills to either solve problems or feel better about problems or tolerate problems. So let me just unpack that a little bit more. So as you've already noticed, DBT is all about skills work. That's a theme you're going to see repeatedly throughout this course. So we're going to teach clients skills basically to empower them, to help them become better problem solvers. But as we know, not all problems in life can be solved. That's why we're also going to teach clients skills to feel better about problems that can't be solved. But as we also know as clinicians, not all problems can you feel better about. So therefore, another goal of DBT is to teach clients skills to at least tolerate problems that can't be solved and that you can't feel better about. So put another way, another one of the goals of trauma-focused DBT is to help clients use their skills to, first of all, get out of hell, and then from there, stay out of hell, and then from there, ultimately, to build a life worth living. So when you see the word hell in DBT literature, it's basically referring to the intense emotional pain caused by trauma and the sequelae of trauma. So we're going to teach clients skills to deal with that emotional pain and to manage that emotional pain, but then ultimately to build a life that they themselves consider to be worth living. And then finally, another goal of trauma-focused DBT is to help clients use their skills to find the middle path between the polarities caused by trauma. That's the whole idea of dialectics. Dialectics is all about finding the middle path between two extremes. So, kind of in summary here, in this course, this is what we're going to cover. So first of all, we're going to learn how to apply DBT specifically to trauma symptoms and the sequelae of trauma. In this course, we'll also be using the polyvagal theory as our theoretical foundation. We will also introduce complex or developmental trauma, right, in contrast to just simple PTSD alone. In particular, we'll discuss how the following skill sets can help trauma survivors stabilize, self-regulate, and find their middle path. And these are the skill sets of mindfulness, distress tolerance, emotion regulation, dialectical thinking, and interpersonal effectiveness. So we'll spend considerable time talking about each of those 5 skill sets and why they're so important and why specifically and how specifically they help clients find the middle path. So here are the key points that we have covered so far in this video. Point number 1. Since trauma is by definition an extreme situation, ongoing trauma tends to force us into extreme responses, either too much or too little. The concept of dialectics is all about restoring balance and finding the middle path between the extremes. Point number 2. DBT teaches 5 main skill sets: mindfulness, distress tolerance, emotion regulation, dialectical thinking, and interpersonal effectiveness. Each of these skills teaches clients a specific middle path between the extremes created by ongoing trauma. Point number 3. Dialectical behavioral therapy, or DBT, was originally designed by Dr. Marshall Linehan to treat symptoms of borderline personality disorder and was based on the biosocial model. Trauma-focused DBT, or TF-DBT, is a modification of standard DBT and was designed to treat symptoms of trauma and is based on the polyvagal theory. And key point number 4. The purpose of DBT is to help clients get out of hell and build a life worth living through skills work. Skills can help clients learn to solve problems, feel better about problems, or tolerate the problem. The purpose of trauma-focused DBT is to help clients sufficiently stabilize and self-regulate so that they can then proceed with deeper trauma work as clinically indicated.